In this video, I'm discussing 5 steps to fixing your squat. Now, you can use these principles if you are coaching a patient or a client and looking to improve their squat, or if you're watching this and you are actually trying to improve your individual squat. So let's jump right into it. Step number 1 is goals. Before we actually throw a barbell on our back and start performing squats, we need to get very clear as to why we're doing the squat in the first place. So when it comes to goals, there's 2 parts we need to understand. Part 1, are we using the squat for an aesthetic or a rehab goal? Part number 2, are we using the squat to bias the quads or the glutes? The thing is, it's really hard to know if what you're doing is wrong or right if you don't know the answers to those 2 parts. So getting clear on those helps us get through the remainder of the steps. Step number 2 is awareness. So we now understand why we are doing a squat in the first place, and now we need to be aware as to the trajectory that we need to move through. Now, independent of whatever your goal is, in general, squats tend to be more vertical and move like an elevator, and hinges or deadlifts tend to be more horizontal and move like an escalator. Now, when you bring your goal back into the equation, that's how you can start to justify, should you be moving more like an elevator or an escalator? I can't tell you that. It depends on your goal. So for example, if you have a hip bias, then you're going to want to choose exercises that has more of a horizontal component. Compared to if you have a quad bias, we're going to want to choose exercises that has more of a vertical component. And so that's why understanding your goal is so important. Stick around to the end where we'll go through a full example of each case so you can understand exactly what needs to be done. But for this, just remember, normally squats are vertical, hinges are horizontal. How you perform it depends on your goal. Step number 3 is patterns. So up to this point, we understand why we are performing a squat in the first place. We understand that there are 2 different trajectories and the bias and the goal are going to influence that. And now we need to understand that human bodies have natural tendencies. What it comes down to are narrow infrasternal angles or wide infrasternal angles. Now, for this video's purpose, I'm not going to dive deep into it. If you want to learn more, check out the Clinical Coaching Foundations course, and I'll leave that in the link below. But for this video's purpose, all I want you to take away is that the narrow infrasternal angles usually are better squatters. Conversely, the wide infrasternal angles are usually better deadlifters. So when it comes to understanding our goal and the trajectory, we need to respect the pattern. Again, we'll go through an example at the end of the video. Step number 4 is exercise selection. Now, up to this point, we've talked about goals, trajectories, and patterns. And when it comes to truly fixing your patients or your squat, those components lead us to choosing the right type of squat. This is a big piece to the puzzle. For example, if the goal is a hip bias, we know we need to move more horizontally. A barbell back squat, because of the load placement, is going to move us more horizontally. That would be correct. However, if the goal was more quad bias, we know we need to move more vertically, then a barbell back squat wouldn't be the best selection. Instead, something like an anterior load, like a goblet squat or a front squat, would be a better decision. Step number 5 is modifications. So now we know our goals, trajectories, patterns, and how to choose the right exercise. Now we need to know, do we need to modify it or do we need to add constraints? An easy constraint is the wall, right? If you have someone that you need to get them moving more vertical, throw them on a wall. They are not going to move horizontal on a wall because they have a constraint, right? If you're looking to improve verticality from a modification standpoint, we could throw someone on a slant board and elevate the heels. This modification biases more of a posterior pelvic tilt at the pelvis, which is going to induce a more vertical motion. So again, understanding all the components before and then really looking, do we need to start to add a modification or a constraint in to really maximize it, fixes your squat and or your patient squat. So let's go through 2 examples so that you can see how this thought process works. Now, I will say, I know the lighting is terrible, my handwriting is bad, there's a little bit of a glare. Don't worry, I'll go through this and kind of point as I'm going and speak through it, but I think it will be really, really helpful. All right, so we have our first example here. They are a narrow infrasternal angle. The goal of this individual is an aesthetic goal with a quad bias, so more of a training client. The trajectory that we want to move them through is more vertical, right? The vertical motion is going to bias more of the quad. The pattern is narrow. What did we talk about? We talked about how narrows have an easier time moving through vertical motions because of their pattern, right? So they're already better squatters. When it comes to choosing the exercise, we chose a front squat. A front squat is going to keep the body more upright, but more so the center of mass going forward because of the weight distribution of a bar or the dumbbell, if it was a goblet squat, allows them to sit back more. The thing is, they almost cancel each other out. You have center of mass forward, you push back more, you split the difference in that vertical motion. Lastly, from a modification standpoint, you probably don't need anything. You could if you wanted to, but again, the narrows tend to move vertical in an easier way. We have a quad bias, and so we probably don't need a modification. Our second example, we're still going to stick with a narrow, and I think this is where it'll really help see the difference and kind of put the pieces of the puzzle together. This individual has a rehab goal and wants to bias the hip, all right? So there's a hip bias with a rehab goal. So totally different than our first one. When it comes into the trajectory, this squat, we want to get them moving more horizontally, right? The horizontal trajectory is going to bias the hip more than the quad. The pattern we already said is narrow, so narrows are better squatters, so they're going to have a harder time to move in that horizontal direction. And if it's a rehab goal, if they're there for pain, this is probably why. They don't have their full movement variability available to them, and so that's why we want to get them moving essentially in ways that they're not good at. From an exercise prescription, I chose a back squat. Why would we want a back squat over a front squat? A back squat, because of the load distribution, is going to naturally bias us to move more horizontally. That horizontal motion is going to bias more of the hips. It's going to start to get this narrow infrasternal angle better at a motion that they're not good at, right? And so that's more of that rehab mindset. When it comes to modification, you could do something such as elevating the toes, right? You could slightly elevate the toes. What does this do? This increases dorsiflexion, and it's going to increase pronation through that foot as they go and sit back, right? And so it kind of naturally pushes them back from a toes elevated position. Now, remember, the examples are great. The bigger picture here is really remembering that we can't just choose random exercise, right? And when it comes to our squat, we should be more intentional with the decisions that we're making. And how do we do that? We do that by understanding the goal, the trajectory we need to move through, the pattern of the individual, what we need to choose based off that, and then any sort of modifications that we may need to implement.